Hi. Do you have a friend who wants to know about premature ejaculation? What is premature ejaculation? Premature ejaculation is defined by mainly 3 points. The first point is that sex lasts less than 1 or 2 minutes. The second point is that the man loses control on the moment of reaching orgasm. And the third point is that these two first characteristics must induce stress on the man and on his couple. So if your friend suffers these 3 points, he can say that he has premature ejaculation. Is premature ejaculation frequent? Yes, it's very frequent. There's data saying that more or less 30% of men will suffer premature ejaculation at some point during their life. There are 4 subtypes of premature ejaculation, and this is very important because every subtype has its own treatment. The first subtype is primary premature ejaculation. Primary premature ejaculation mainly appears from the very beginning of the onset of sexual relationship. So men having primary premature ejaculation will have mainly this problem all their lives. Primary premature ejaculation is related with a low time of intercourse, around 1 minute, and the treatment mainly deals with drugs. Secondary premature ejaculation appears after a time of normal sexual intercourse, and it's mainly associated with some urinary tract infections like prostatitis, or some psychological or biographical issues, change of your sexual couple, etc. The treatment for secondary premature ejaculation is mainly based upon the treatment of urinary tract infection or sex therapy. Sex therapy works very well in these cases. The third subtype of premature ejaculation is natural variable premature ejaculation. And we have to say that this is not abnormal. This is something very common. Some men just have different duration, so they just last longer or shorter depending on the situation. This is not an issue. This is just something normal. So this is not a problem. So this doesn't deserve any treatment. And the fourth, the last subtype, is pseudo-premature ejaculation. These are mainly men coming to the outpatient clinic saying that they have premature ejaculation, but they don't. We have to know that the duration of sex in Europe is like, the mean is like 5 minutes. So some men just think that 20 minutes or 10 minutes is suffering premature ejaculation, but it is not. In these situations, it's just necessary to inform the patient and to cool these patients down so they get the right information, and most of the times this is just enough to solve the problem. Now we leave you a scheme with the 4 subtypes of premature ejaculation so you can have the visual idea of how this works. We have primary premature ejaculation from the very beginning of sexual relationships. It's constant and it's associated with a short time of intercourse. Secondary premature ejaculation, it appears at a certain point of your life. It's constant and it's associated with a slightly longer time of intercourse. Natural variable premature ejaculation, it's unconstant. It usually happens all your life and it's related to longer time of intercourse, around more or less 5 minutes. And last, we have pseudo-premature ejaculation. It usually happens during all your life. The time is constant and the time is usually long. And as I said, it's constant, but it shouldn't be considered a problem. We hope this video was useful to you. I would like to remind you that the best diagnosis leads to the best treatment. So if you really have a problem, don't hesitate and just go to your health professional. We have other videos dealing with premature ejaculation in the channel, and I would like to remind you that we have also videos dealing with sexuality and other sexual issues in the channel. Thank you very much.